Well, hello everyone. This is Jeannie White from Social Connections on Passion Radio. And today we're going to be doing a follow-up with Sheila Wilson, who is the president and CEO of Stop Healthcare Violence. And she's been an advocate working diligently for this House Bill 795 to changing the prior bill from a misdemeanor to a felony. And so right now, this bill is House Bill 795 is in the third reading. And I want to introduce Sheila.
Hi, Janie.
Hi. So let's give a little bit of an update on what's going on with this House Bill 795, that we've been working on.
Yes, back in May, we thought the bill had gone into study again, which it did the last time. But it went to the third reading committee. And that means that they have to check everything off and decide whether or not it will go down to the next committee. So what we've been doing is calling and writing and emailing these folks to let them know how important it is to change the Massachusetts law from a misdemeanor to a felony like 34 other states. It's not an easy job. And I called the research person. Now I'm doing it once a week to find out where the bill is. I think they have until the end of January to decide whether or not what to do with the bill. Mm-hmm. And I don't know if all of the people that are listening know that 70 to 80% of healthcare workers get assaulted.
I'm not sure everyone's really aware of that, Sheila. I think by what you're doing, you're bringing it more awareness to it. About the stuff that you do on Facebook, on YouTube, you do different events that you go to and you're in speaking engagements. So there's many things that you do. You go to the State House too.
And that's fun. It's fun to go to the State House and to meet people. You don't usually meet the representatives or the senators, but you meet their aides, the directors, and you sit there and you chit chat. And I had a great person when I first started, and he no longer is up there that I'm aware of, but he was somebody that I could call anytime and get some information.
Okay. And he was very instrumental in the very beginning, helping us to get through, guiding us a little bit too. His name was Sean.
Yes.
Yeah. And he was very helpful to us, and so what do you want people to do?
Well, if at all possible, if they could, they don't have to be a healthcare worker to let people know that we need to have a felony law in the state of Massachusetts. Like I said, the other 34 states. And if I put this up, I don't know if they'll be able to, they won't be able to see it, right?
Yes, they will. They
will. Yeah. Okay. So can I
put it up?
Okay. And this is the chairperson. His name is Theodore.
You got to bring it over to the left, Sheila. Sheila, please bring it over to the, okay, right there. Stop. Bring it up a little bit. All right, stop. There you go. It's the State House, 24 Beacon Street, room 20, Boston, Massachusetts. The phone number is 617-722-2410. And I'm not sure, I don't remember his name there, Sheila.
Well, his name is Theodore, and I'll spell the last name, S-P-E-L-I-O-T-I-S.
Okay.
And he's the chairperson. Now
Right.
I want to put the vice chair. Can you see that all right?
You got to bring it down a little bit. So, bring it over to the right, to my right. No, to the left. There, right there, State House. She's also on 24 Beacon Street, room 236 also.
Yeah, well, that's her room number.
Can you bring this up a little bit so we can see the phone number?
Yeah.
Right there, stop. 617-722-2430. And her name is?
Her name is Carol Fiola, F-I-O-L-A.
And you want them to call up And tell them
And-
what?
To support the bill. To
What bill?
support support Bill 795.
House
The
bill,
House-
you gotta specify House bill.
Oh, the House bill, you're absolutely correct.
Yeah,
House Bill 795.
yeah. And if they could do that, we really appreciate it, you know, to more people that call in, the better off it is for this bill, because it hasn't died, it's still there. So it has some merit to that bill.
Yes, it does. Well, there's so many of us get assaulted all the time, and I hate to say that because we don't write out a lot of reports on these incidents,
What kind
nothing
of-
has changed.
Yeah, what kind of reports are they, Sheila?
The incident reports.
Okay, like, because you need to specify what they're doing, their names and stuff, you know? So they have to fill out this form.
Well, they should, so that the institution or facility or the powers to be know that these things are happening to us.
Mhm.
And without them, they don't know. And it's just like anything else. If you don't know what's going on, you don't know what's going on.
Mm. And then, you know, if you don't say anything, nothing changes either.
You got that right. Nothing will change if we don't say anything, and we have to fight for it like everything else.
And so how many states do we have now?
34 states have a felony. Now, they're all different. What the felony went, some of the felony only will cover the emergency room nurses.
Mhm.
This bill will cover everybody, anybody that works in that institution. So if Massachusetts actually passes it, that would be terrific. Now, it won't only help, I'm sorry, excuse me, it won't only help the healthcare worker, but it certainly will help the person that assaults us.
Right, because it'll help them to take care of themselves and maybe have, when they go into court or something like that, find different ways to help this individual should they have any, you know, like maybe drugs or alcohol or something, and to help them to get better.
Yes, yes, we did that one time with we went to court, and we really were diligent about this person. She was a psychiatric patient, and we ended up she didn't go to jail or anything. She assaulted just about anybody she was in front of. And we ended up getting something which is called a Rogers. And because she didn't take all her medicines all the time, this is mandated by the court, and somebody had to go over and give her medicine. And that helped her so much. So she was back on track.
Mm-hmm. So in actuality, it helps both. It helps the individual that got hurt and the perpetrator, the one that caused it. You know,
Yes.
And each one will be taken care of. You know, the individual that provoked this is going to be in some sort of a program that will help him and probably even help his family out too. You know,
Right.
help him out. So it's a win-win for both sides, really.
Well, it is. It is. And I'm just hoping that it will help, because if they know that it's going to be a felony, but that's not the only thing. We have so much to do in the healthcare business to help change this epidemic of violence.
Uh-huh.
And I could go through a whole list as to, you know, what the institution can do and what we can do as healthcare workers.
Well, I think probably the first thing here, well, one of the first things is to get this bill passed, and then, you know, proceed on to another, you know, solutions.
Yes,
This is going to be one solution, is passing this bill.
it certainly would be.
Mm-hmm. So do you recommend, you know, can you just read off the numbers again to the people to call?
Oh, sure. If you call Representative Spiliotos, and I'm saying that wrong, Theodore, the telephone number is 617-722-2410. And chances are you won't be able to talk to him. You'll be talking to his aide or the researcher, Chris.
Mm-hmm.
And the other one is Carol Fiola, and her telephone number is 617-722-2430. And her aide or somebody will answer her telephone, and that's all you're talking to, and you don't have to carry on this big conversation. All you want to do is tell them that you support the bill.
What bill?
House Bill 795.
Yeah, it's important when you say that. It's important to say what bill it is, so they'll know it's House Bill 795. I mean, I give you a lot of credit, Sheila. You've been working for this for quite a few years now. And each year you learn something more to be able to get to this plateau now, where this bill is not dead. It's there. It's in that third reading, Really have to commend yourself for doing that, because I don't know, I mean, I'm just talking for myself. I didn't see there is support, but not as much support as I thought there should be. But that's just my opinion,
Right. Well, last year, what they did, instead of passing the bill for us, for healthcare workers to protect us, they decided to pass a law for liquor bills, liquor laws.
Liquor license, yes.
So, I mean, that's like, how does that fit on you?
Well,
we're not important.
No, you know what it is? It all comes down to money. They're going to get money when they pass these different bills. The people are going to buy these licenses. So, the bottom line, they're always looking at that spreadsheet.
You're absolutely right there, Jeannie.
Yeah, that's it.
Bottom line is important.
The bottom line, and so you need to talk to your legislators, and you did vote them in, and you can easily vote them out.
That's right. But the one thing that I did learn going up to the State House is these people, they're really terrific. It was something I hadn't been accustomed to, and now for the, past 8 years?
Yeah.
We've been trotting to the State House, talking to people, roaming around, checking things out, and they're lovely. They really are, and they'll help you in any way that you're asking.
Yeah. So, I mean, I know we're coming to the end. So, is there anything I know you'd want to sell the bill again, the House bill and the phone number, and we can always put that on the post when I post it for you. But really do a call to action, Sheila. You listening?
I'm listening.
Oh, okay. Call to action. What's the call of action? The House Bill 795 call.
That's right. Call.
Oh my
All I can think of is your call to action, and what number do you want me to call?
Well, I think that's what it is. You put it out there and say, this is a call of action. We're calling for you to do X, Y, and Z. I mean, we all have cell phones, so I don't want to hear that, oh, I'm not too busy, because everyone has their phone in their hands. And if they really want to help you, they can call those phone numbers and help out. They really can.
It's not only to help me, Jeannie. I'm not in the same position I was a few years ago, working in the ER and getting assaulted every third night.
Yep.
I'm in a safer place, but I'm trying to do this for all the nurses that are still working in hospitals, in nursing homes, and psychiatric hospitals.
Right.
And the psychiatric nurses really go through an awful lot. And so don't the emergency rooms. And some of these folks are violent, and they send them to the floors, and they assault the nurses and medical assistants. Or we just had an email from a mammogrammer, and she was assaulted while giving a mammogram.
Mm-hmm.
X-ray techs get assaulted. They're in a place all by themselves. They don't have the tools. They don't have panic buttons. They don't have any of this. And just think, when you get in a chest X-ray, you're in a room, and usually the door will be locked,
Mm-hmm.
or at least closed, and you're by yourself. And a CAT scanner.
Yeah.
It's only you and the CAT scanner.
Right.
So the places can be very dangerous.
Because yourself, when you go in for a mammogram, the door is shut. And it's
Yeah.
not a big room. There's very
No.
limited space there to move around, and so you can see how if she got into trouble, there's no escaping.
No, there isn't any escape.
Yeah,
And it's one way in and one way out.
that's right, yeah.
So there's a lot of things that can help with a situation like that. But we need to work on it.
Yeah.
And this,
Well, that's because of you. I mean, I know that it's going to help a lot of people, but I'm still talking as for me to interview and say that you had the boots on the floor there. You were the one that was doing a lot of the work.
I am. I do have a board, and
Mhm.
some of them are terrific.
Mm-hmm.
But some are very busy too, and some live out of state.
Mm-hmm.
So it's but it's hard. But you get the emails and you get the people that get assaulted, and what do you do about it? And especially when they're out of state.
Well, sometimes, I know the laws in our state are much different from, say, Illinois or Florida or California, but, they can still find some information on your website, Sheila.
Oh, my website is www.stophealthcareviolence.org. And anybody can go there. They can listen to videos. They can they can read the stories I've written. And some of the stuff is very sad.
But there's references there too.
Lots of references. And I also wrote a book.
Do you have your book?
I do. Let me see if I have it right in front of me. I should have. But it's the shocking reality of violence in healthcare and what we can do about it. No, I had thought I had it. I'm sorry, I don't have it with me, and now I don't. Oh, are you still there?
Yeah, I'm here.
Okay. I don't know what happened, but I'm not with you unless I'm with you on that end.
If you, again, if you go to Sheila's website, stophealthcareviolence.org, the book is there.
Yes, it is.
Yeah, it is there. So you'd be all set, and that's it. Is there anything more you'd like to say, Sheila, before we end?
Not at this time, no.
Maybe we'll come back in another month, a couple of weeks, and do another follow-up, like 15 minutes about what's going on. What are you doing, Are you adding more stuff to Facebook? Are you doing more speaking engagements? Have you been into the State House? That kind of stuff. Just like a little 15-minute update on what's going on with this House Bill 795.
Okay, I would love to do that. Thank you very much, Jeannie White.
Okay, thank you, Miss Sheila Wilson. I want to thank everyone. This is Jeannie White from Social Connections on Passionate World Radio. I didn't mean to sound like I was yelling or anything. I was trying to I was telling Sheila to stop. So, and when you were putting the paper up to show people, So I don't want anyone to think I was yelling at you.
Oh, okay.
But I want to thank everyone for listening to this and in our video. And if you have any comments, you can send a comment to Sheila W6@comcast.net or jwhite7033@comcast.net. I want to thank everyone for listening to this video today. It was very informative. Thank you again, Sheila.
Thank you.
Okay. Thank you.